ASD has a complex genetic etiology with symptoms unfolding over the first few years of life. Infants who will go on to develop ASD are not born exhibiting full autism symptom expression. Rather, as symptoms emerge, developmental milestones are derailed, resulting in a diverging trajectory away from neurotypical development. Thus, some infants appear to be developing within age expectations in the first few months or even the first year of life, but they then fail to keep pace with chronological age expectations during the second year. As developmental divergence occurs, typically developing milestones can fade, while the presence of atypical behaviors can emerge. It is therefore essential that clinicians be knowledgeable of normative development in addition to merely observing for the presence of ASD symptoms, because it is often the case that infants at risk for ASD have words, eye contact, gestures, etc., but the limited frequency and range of these skills are what causes concern. Research indicates that 80 to 90% of parents report their first concerns about their child's development by the second birthday, and often earlier. However, the mean age of diagnosis continues to be over the age of 4, despite these concerns. When experienced clinicians make a diagnosis of ASD at 18 to 24 months, the stability of diagnosis is quite strong, also around 80 to 90%. This highlights the extremely concerning gap between when first concerns are raised and when something is actually done to help the child, often because of limited awareness of the early markers of ASD by professionals on the front line, as well as barriers to access to services. These facts underscore the necessity for clinicians of all disciplines to learn about and be vigilant of the early signs of ASD, so that children can be effectively evaluated and efficiently diagnosed. These include, but are not limited to, delays or deficits in joint attention, shared affect, social smiling, response to name, frequency and range of gestures, communicative intent, and functional speech. In autistic toddlers and preschoolers who have intact cognition and language, social vulnerabilities can be masked by strengths in other areas, such as precocious language, fixation on numbers and letters to the point of self-reading, and burgeoning circumscribed interests. It is typically not until these children are immersed in social settings, where the social demands outweigh the capacity to engage, that social concerns are raised.